Hi, everyone. Welcome to our Unit 1 discussion here in ST 120. Hopefully, you guys are off to a good start here in the summer quarter. So, a little bit about me if you haven't had me as an instructor yet. I've been teaching with Herzing for a full year now, but I have been teaching Surge Tech for about 12 years. So, um, these are my kids right here. I have two kids, two dogs. I also have another teaching job that I work full time. So I'm currently teaching full time. I used to scrub at one of our local hospitals on the ENT and I team. That was my specialty. I really enjoyed those types of cases, but I got to do all of the cases, general ortho, neuro. We did pretty much all of it. So I'm I like to think I'm pretty well rounded just because I got to do a little bit of everything. So this is going to be your textbook for the course. If you haven't gotten it yet, I know some of you have already emailed me. um, it's maybe running a little behind. That's okay. I'm not going to penalize you for not having that turned in if you don't have like the workbook or text yet to work from. So if it is running behind, just let me know. That's not a problem. All right, so every week I like to give you kind of like a what's objectives, what to expect. Um, I also will share with you the assignments for each week as well. I know you can find those in the syllabus, but I like to remind you of those too. So this week we are going to just start with the basics of sterile processing, how to identify what is sterile and what isn't, what do those terms mean, and just the basics of what a sterile technician does. Okay, so here are your assignments for Unit 1. Notice you're going to have a discussion post for every week. This is probably nothing new to you. If this is not your first Herzing course, we do a lot of discussion posts. So you also need to respond to a peer. Do not forget to do that. That's probably where I take the most points off, is not going back by Sunday and responding to your peers or not citing your sources. Those two, I think, probably are the most points that get taken off. And those add up over time. You don't want to risk it there towards the end. This pretest is for points, okay? It's not optional, so make sure you do that as well. All right, so let's start with the Central Services Department. What does that mean? I know some of you, your backgrounds do vary a little bit in that maybe you already are working as a sterile processing tech, um, and you're coming to get certified, which is great. Some of you may not have ever stepped foot in an operating room or a sterile processing department, which is fine, but this is the basics right here. So the Central Services Department is centralized in most facilities, and it is where we reprocess and process equipment needed for like surgery, maybe even in the ER or on the floor, those types of items that can be reused more than once and they have to be sterilized so they're safe to use on patients so we don't spread infections. So services as well as the operating room always will have education and standards that are evolving. So you have to like learning if you're going to stay in this field because things change. So you have to stay up to date with those things. And if you become certified, then part of your certification process is to keep up with that. You have to maintain your education through what we call CEUs, continuing education units. So this department is sometimes called a lot of things. It just depends on where you work. We always called it sterile processing where I'm from. Some people call it the central processing department or surgical supply. It's a lot of different, or CS. It's kind of abbreviated CS pretty often. So it just depends on where you work. So what does a sterile processing tech do? There are several things. This is very basic, okay? There's a lot of very minute details that the sterile processing tech will have to do to be good at their job, but you can kind of summarize it here in, communication skills, because you do have to interact with a team. It's not just you. A lot of times you have to communicate with the operating room. What trays are you working on? What are you missing? What do you need? What do they need? Maybe even the floor nursing staff or ER. So there are multiple ways in that you communicate. Respecting patients' rights is huge because, this is why we do what we do, right? We want to respect the patient. We want to do what's best for the patient, and they have the right to good health care, right? So Keep that in mind every day you go to work, is that's what we're there, is for the patient. And then our basic responsibilities are understanding microbial transmission, IFUs, which is instructions for use, sterile processing practices, and procedures. So that is very basic and generic, right? But, as we go through the next 8 weeks, we will talk about those in greater detail. So in our sterile processing department, you have three basic areas. You have a soiled or a dirty area, then you have a clean processing area, and then you have the sterile storage area. Typically, they are right next to each other, maybe divided by walls or some sort of partition, but they are usually like in a 1, 2, 3 type flow because they all work together. That's the whole department, but you have to have each area separate. So the concept behind that is to keep clean and dirty separate. You'll hear us say that a lot because if you have something that is clean that you carted through a dirty area, even though it may look clean, it's still considered dirty. You have to keep clean and dirty separate. And it is a one-way flow. Like I just said, you can't go back and forth. You can't take something from sterile storage area to the soiled area. You just can't. Okay. And then this term decontamination is what we kind of refer to as our soiled area. So, or we call it decontam for short. So this is where our dirty instruments go first. Okay, so if we use something in the operating room, like a dirty tray or whatever, it gets sent down to decontam, and then they will remove the contaminants to make it safe for handling. So they're gonna hand wash a lot of the things, maybe put it in something called like an ultrasonic cleaner that gets rid of that blood, patient tissue, dirt, debris, and then put it in the clean processing area. That way we can re-sterilize it, handle those items safely. So a couple terms here you need to understand the definition of, because this term sterilization, I think students just kind of throw around and they don't truly understand the concept. But if something is sterile or to be considered sterile, it means that there are no living microorganisms on that surface, including spores. Spores are the hardest things to kill in the realm of bacteria. Okay. So certain bacteria, not all, certain bacteria can form spores, which is like its own little way of protecting itself from being killed. It becomes really hard to remove and more like heat resistance and that sort of thing. So those have to be removed from the surface of the items through our sterilization process, usually through heat, time. You could use certain chemicals to render those items sterile. Okay. So even if something is what we call clean, clean and sterile are not the same thing. Clean can have some spores on it or some microbes, but it is not sterile. So they are not synonymous. Make sure you get that. For sterilization, certain parameters have to be met according to your IFUs. So whatever the machine you're using, whether it's the Steris, Sterad, whatever, steam processor, you have to make sure that you're using it correctly, or it may not render the item sterile. So IFUs are very important. All right, our sterile storage and distribution is, like I said, kind of those storage areas. Most are going to be kept in that same central sterile processing department. Now, once the operating room or whoever needs it, it will be, taken out or counted out by the department, usually taken to the operating room by a case cart system, which is pictured here at the bottom. This is a case cart or a version of one. There's a lot of versions of case carts. Some don't close. Some are just open racks that you push. But it's something similar that you can take all those items to the operating room for each individual case. So surgical cases, like this would be for one case here in this case cart, are picked by what we call either a pick sheet or a preference card. Anymore, they're mostly digital, but they could be paper depending on your facility. But let's say Dr. So-and-so has a laparotomy in OR1, okay? So we can pull up in the system that doctor's name with that particular case, and then you have everything that surgeon needs for that laparotomy. Now, another doctor may have something completely different on their laparotomy card. So a lot of things are surgeon preference. You might learn some of those over time and may not have to stare at the pick sheet so often, but you still have to check it to make sure as you go down the list that everything is there that we would need for surgery. All right, so the processing cycle of, the big picture, I guess you could say, is let's say we just dispense something, right? Well, actually, let's see here. Let's start with um, storing it. We've stored it, we're taking it out, dispensing it to the OR. Um, Maybe it needs cleaned again, inspected, reassembled, repackaged, re-sterilized over and over again every time it's used between dispensing and cleaning um, until the item is no longer usable. So an instrument, let's say a hemostat, could go through this processing cycle, hundreds of times, thousands of times before it's no longer safe to use. So every time you use something, you have to inspect it, make sure it's safe to be reassembled and repackaged every single time, every instrument. So each step of the way here is very important. And that kind of goes with ethics, right? So ethics in sterile processing really is very important, and a lot of people don't realize the importance of sterile processing because they're kind of off to the side. They're not, up front like the face of the hospital, like nurses and doctors. But without the sterile processing department, the hospital would cease to run. Patients would not be receiving good health care if we did not have a good sterile processing department, because you all are going to be the ones that make sure our patients have clean and sterile items for their procedures, which you cannot put a price on. That is so important. So it goes without saying that you have to have a good work ethic and you have to have a good conscience. When we're in surgery, we call that surgical conscience, making sure we're doing the right thing when no one is looking. That can be hard for some people. If no one's looking, be like, oh, I can slip this by. Nobody sees me. It's fine. There is no place for that in healthcare, sterile processing anywhere. So if that is your trait and you know it, you may want to really consider, is this the right job for me? There is no room for cheating or trying to slip by or doing things halfway in sterile processing because our patients' lives truly depend on it. Okay, we will practice things called standard precautions in which it protects the patient and you as the healthcare worker. Like you're treating everything like it has an infectious disease. It's a good standard of practice. If you get an item down in decontamination that doesn't look dirty, maybe it doesn't look as dirty as the others, and you think you can get by with just, I'm just going to squeeze this one by, it looks fine. That's not necessarily true. There could be invisible to the naked eye bacteria on that. So you have to treat everything like it is infected or contaminated. Okay. So ethics is very important. So let's take a quick look here. If you've never seen a sterile processing department, this is a good brief little video to show you what the department looks like, what you would be seeing on a daily basis.
Right here. We're in the sterile processing department, and it's where all the surgical instrumentation gets cleaned and sterilized for any upcoming surgeries. And not many people get to see this area, but I'm going to give you an inside look into the sterilization process. Each day, we see hundreds of different types of instruments that require hundreds of different ways to clean them, and each sterile processing tech must learn these to ensure that the instruments used are safe for the next patient. Instrument reprocessing begins in the decontamination room. This process begins by soaking and manually cleaning each instrument in a sink filled with a water and detergent mixture. This helps break down and remove the blood and other materials that can be left from surgery. We call this material bioburden. We use a variety of different types of brushes, syringes, and automated irrigators to remove the remaining bioburden from the instruments. After all the bioburden has been removed from the instruments, we rinse them and move them to the next step in the process, ultrasonic cleaning. With ultrasonic cleaning, we are removing the remaining biofilm that cannot be seen. Ultrasonic cleaning works by creating ultrasonic waves that travel through the water. These waves create tiny unstable bubbles, and when these bubbles come in contact with the instrument, they implode and remove the remaining biofilm. After all the biofilm has been removed, the instruments are rinsed and prepared for the final step of the decontamination process, mechanical cleaning. Mechanical cleaning is done in a washer disinfector similar to a high-powered dishwasher. This step removes anything that might be left on the instruments. The washer rack has spray arms that spin and clean the instruments using detergents and high-pressured spraying water. Each cycle provides a thermal disinfection so the instruments are safe to handle. When the cycle is complete, we can now inspect and assemble the instruments in preparation for sterilization. Assembly begins by inspecting each instrument to ensure that they are working appropriately. We then arrange these instruments into sets that will be used during specific types of surgical procedures. Each set has many types of instruments in common, as well as instruments that are unique to a specific surgical procedure. So each sterile processing tech is responsible for learning each instrument and how it works. This provides the surgical staff everything needed to provide excellent care for our patients. We then prepare the instrument set for sterilization by placing all the instruments in a mesh basket. The basket is then placed in a specialized container that is designed for sterilization. Some containers have a sealed hard outer casing, and some must be wrapped with a specialized material called blue wrap. Both types of containers are designed to allow the instruments to be sterilized in the container, and once sterilized, maintain the safety of the instruments while in storage. Sterilization is done by using different methods such as steam, vaporized hydrogen peroxide, and a variety of other methods, but the most common instruments that are used in a surgery are sterilized using steam. To make sure the sterilization process has been effective, we use chemical and biological indicators. Chemical indicators are placed on the outside of blue wrap or rigid container and allow us to know at a glance that the instruments have gone through the sterilization process. They are also placed inside the container with the instruments so the surgical staff knows the instruments were sterilized and safe for use on our patients. The biological indicators help us verify that our sterilization process is effective enough to kill all the germs that may be on our instruments. This process helps us know we can provide patients with the best possible care. Once the instrument set has been sterilized, they go into our sterile storage area until they are needed for the next surgical procedure. This area is also the staging area for the next day's surgical procedures as well as potential emergency surgeries. Once the instruments are ready, we assemble them on a case cart to be sent out for surgery. Be sure to check out mgmc.org for more information.
All right, so hopefully that gave you an insight if you've never seen the SPD department. There were a lot of really good vocabulary words in there and things that you're going to see on a daily basis, things that we're going to talk about over the next several weeks. So need to go back to that video just to give you, a little bit of a brief overview. Feel free, okay? So conclusion here, just to wrap up, just remember that this job that you're going to partake in is integral. It is such an important part of the hospital. So don't take any of this lightly. Um, if you're just in it just for maybe something to do, I'd really consider if this is the right job for you because it's very important to make sure that we have what we need for our patients and that it is um, sterile and it was done up correctly. So, part of the job is decontamination, prepping it for sterilization, repackaging it, and then starting that whole cycle over again. So, throughout the next 7 weeks, eight, well, not counting this, 7 weeks, we will talk a little bit about anatomy, med term, and how we can apply that to knowing what those surgical procedures are to allow you to make sure you are picking the right things for those cases on those preference cards. And working together as a team, if that's not something you're used to, maybe practice that. It does take practice, um, just working with other people. If you can work well with a team, things are just going to run more smoothly overall. And that's what we're there for. Just remember you're there for the patient. Okay. So every, like I said, every week I tell you what to do, but you can also look at the calendar or your syllabus. If you're not familiar with that, the calendar is here. Kind of, you like that big overview, some people like that. So just keep an eye on your dates. Don't get too far behind. If you think you're going to be behind on something, just let me know. I'm pretty understanding about that, okay? So just keep me in the loop. I do have office hours on Tuesdays. I know it's already Thursday, but it was posted in the announcements, but office hours on Tuesday where, I'll just get back to you a little bit quicker. And then, if that doesn't work and you need to talk, we can set something up. Not a problem. Okay. So reach out if you have any questions, and I will see you next week.